Before we jump into questions, Dr. Baumgarten, I wanted to see if you could just give everyone tuning in today just an update on where we stand with monkeypox cases, including United States case numbers and also local Louisiana and Mississippi case numbers.
So in the United States so far, the CDC reports that we've had 18,101 cases of monkeypox across the United States. We've had our first case in Louisiana on July 7th of this year, and so far to date we've had 176 cases confirmed in Louisiana and 30 confirmed in Mississippi.
Okay, and I think people's main concern right now with monkeypox is just because of everything we've gone through with COVID, maybe worry that this could get to the level that we've seen with COVID-19. Do you foresee that happening with case level with monkeypox?
Well, we haven't seen it spread that quickly so far, so we don't anticipate that that will happen. And the reason that that's not likely to happen is the mode of transmission is a little bit different with monkeypox. So as with COVID, it was transmitted more easily, and we've seen that happen with each of the variants, that the transmissibility of it has increased, that it's more transmissible from person to person. With monkeypox, the mode of transmission is a little bit different, and so it's more difficult to transmit. So we don't foresee that it will be spread as quickly as COVID, and perhaps not to the number of people that we've seen with COVID as well.
Okay, and I think that's a good segue into just kind of explaining what monkeypox is, where it originated. Dr. Kemmerly, I was wondering if you could give a quick little overview on that.
Sure. So monkeypox has actually been around, first identified in 1970s and in the 80s. And it's a virus caused by the monkeypox virus, which is similar to, virally speaking, the smallpox virus, but it's far less severe. And so the disease is rarely fatal in monkeypox, where smallpox caused much more severe and was a true problem for the world. And fortunately, smallpox has been eradicated from the world since 1980. And so, monkeypox is, now a problem, and it's being seen around the world, but certainly not to the extent, as Dr. Baumgarten mentioned, of COVID, and the transmissibility is far more different and harder to get than just the aerosolized from COVID. And we think that it's endemic in Africa, so as I mentioned, it's been there since the 70s and 80s, and probably due to international travel and people's mobility, it has certainly moved to other countries. So we will continue to see this for the short term until perhaps people get vaccinated against it.
Okay, that's good to know. And with you mentioning that it is endemic in Africa, is that something that we hope to reach in right now with people getting vaccinations?
Yeah, I mean, with all vaccinations, what we try to do, it's whether or not we actually eradicate monkeypox from the world probably won't happen the way we did with smallpox, because there's not a worldwide campaign to vaccinate against monkeypox like there was for smallpox. And so, as I mentioned, smallpox vaccines really stopped in the 1980s worldwide. So the likelihood that we'll vaccinate everybody on the planet for monkeypox remains low, but certainly with the monkeypox vaccine, we can certainly hope temporize and have less cases.
Okay, and Dr. Denton, I think people are mainly concerned with how they can get it, what situations they need to be in to contract monkeypox. So I was wondering if you could give an overview just how someone might get infected with monkeypox.
Yeah, sure. Monkeypox is spread through prolonged close contact with somebody who has the illness already. That can be intimate contact, like kissing with respiratory droplets spread that way, or direct contact with the rash if somebody actually has the rash. You can also get it through contact with items like linens or clothing that has been exposed to the rash, so it's important to think about hand washing and things like that.
Okay, great. And one of the things you kind of mentioned before with close contact with people, I think one of the biggest misconceptions we have seen is that monkeypox is a sexually transmitted disease. Can you kind of explain why that's incorrect?
Yeah, thanks for bringing that up. That is a common misconception that it's sexually transmitted. Certainly, monkeypox can be sexually transmitted, but that is not the only way monkeypox can be transmitted. That's why we wouldn't call it a sexually transmitted illness. In this outbreak, it's spread primarily through close personal contact. Okay. So that could be skin-to-skin contact, or contact with a surface that has the monkeypox virus on it.
Okay, and if you could kind of go into who might be most at risk for monkeypox, I think that's another level of concern, you know, also with kids going back to school, people wondering if their kids could get it, so just a general overview of who might be most at risk.
Yeah, anybody who has close contact with somebody who's infected with monkeypox, that's really the key thing to think about. Pregnant people are at very high risk for complications because monkeypox can be spread to the fetus and can cause pregnancy complications as well.
Okay. Dr. Baumgarten, Dr. Kemmerly had kind of touched on this earlier, but is monkeypox fatal in any way?
So there's two different strains that we talk about when we talk about monkeypox that circulate in Africa. The one that is circulating now here has a very low risk of fatality. And we talked about there being 18,101 cases here in the United States, but there's been no deaths in the United States here from monkeypox. So I think that's important to keep in mind. And we also know with this particular strain that's circulating in the United States that the risk of mortality is thought to be less than 1%. So that means that it's less fatal or deadly than, say, COVID was. So that's a little bit reassuring. Now, we do worry about, like Dr. Denton mentioned, there may be some groups that may be at higher risk for either death or severe disease. And those may be in pregnant women. We talked about that a little bit, so they're more at risk for severe disease. Those that are under the age of 8 may be at more risk, and those who have other conditions that may suppress their immune system or other severe skin conditions. So those are the groups that we may be a little bit more concerned about. I mean, we may choose to treat those groups also, and we also want to make sure we focus on vaccinating those groups. We want to vaccinate everybody that's at risk, but especially those that may be at more risk in those particular groups as well.
Okay, and if someone does think they're coming down with monkeypox, can you give a general overview of what symptoms they might expect?
Sure, so the CDC talks about the symptoms that we're seeing here in the United States, and overwhelmingly, the first symptom that people have is fever and rash. Rash, of course, is what we've talked about with monkeypox. That can be pustules, it can be blisters, and that rash is what is kind of the hallmark of monkeypox. And over, you know, everybody that has it will have that rash, and that's how we diagnose it as well, is the rash. But prior to the rash, there are people that will get fever, malaise, fatigue. About 1/3 to 3/4 of people can get that fever, malaise, fatigue, headaches, sometimes some respiratory symptoms as well. And those usually last several days, and then the rash comes after those symptoms a few days later as well.
Okay, and I know I've seen some reports, both on my TikTok feed of people reporting what symptoms they get, and just on the internet as well, people getting sores on their face, including their eyes. Is there any risk to getting sores in the eyes, and what kind of effect that could have?
So getting sores or getting involvement of the eyes is pretty rare. Most typically, we're going to see the rash on the hands, the palms, the soles of the feet. It can be in the mouth. Sometimes it can be in the sexually transmitted disease areas, such as the anus, the genital areas. But to get it into the eyes is pretty unusual. And it can look kind of like pink eye. So I think most people are familiar with pink eye or conjunctivitis. Again, unusual to see that, but we treat it in the same way, meaning, you know, symptomatically with treatment. If it needs be, we can get treatment or oral medication for somebody, or just symptomatic care like eye drops, cold compresses, that sort of thing.
Okay, great. And that's a kind of great segue into my next question for you, Dr. Kemmerly, is just what should someone do if they are exposed or start to develop symptoms?
So if they're just exposed, if somebody has been notified that they are exposed, then they needed to monitor their symptoms for 21 days. However, if they develop symptoms, the fever, the headache, that may occur before a rash may develop, then they need to isolate away from others. They need to seek medical attention. If they have presence of a rash, they need to be tested for monkeypox. And so we certainly need a rash or a lesion to be present on the skin to do the testing. And right now, the testing is taking, at a minimum, 3 to 5 days, at a maximum, a couple of weeks, because they're all sent out to reference labs. And so while that test is pending and someone's symptomatic, we ask them to stay away from others in isolation so they don't spread the disease.
Okay. And is there certain places that people should go if they start to notice symptoms, like urgent care, is their primary care doctor? Who would you recommend they reach out to?
Their medical provider. Certainly we don't want them going to the emergency department just for testing, because it's not an emergency. And so we want to be respectful of the car accidents, the heart attacks, the strokes that come into an emergency department. But certainly urgent care centers can do that, primary care physician's office, urology offices, OBGYN offices. Those all, the testing's not, it has to be sent away for the test to be performed, but the actual collection of the test is pretty simple.
Okay, great. And then if you could also expand just on how someone can protect themselves from monkeypox, what are the best steps to take to try and help not get it?
Certainly you want to avoid close contact with somebody who has monkeypox. Certainly, if someone that has monkeypox, then should avoid linens, sharing items and stuff. Hand washing, we're in infectious disease doctors, we love hand washing, so a plug for hand washing for all. And so really just the environment, and avoid the close personal contact with someone who's infected.
Okay, and I know right now what's on a lot of people's minds is vaccination. That's also a way to protect yourself, but there are certain eligibility requirements that go into vaccines right now. So Dr. Denton, I was wondering if you could kind of explain who is currently eligible for the monkeypox vaccine.
Yeah, great. I'd be happy to jump into that. So the CDC has a certain set of guidelines for recommendations for vaccinations, and the Louisiana Department of Health does as well. In my mind, they're kind of, I think of 4 groups, like people, direct contacts of somebody with monkeypox. That might be, somebody who has a family member or a household contact with monkeypox, or that might be a healthcare provider who has taken care of somebody with monkeypox, or thinks they might take care of somebody with monkeypox. So that would be the first group I think of. The second group that's probably at the highest risk right now are sexually active men who have sex with men, including transgender persons, particularly those who've had multiple sexual partners within the last 14 days, or who've had sexual partners in a public space. We talk about those, and that's in the Louisiana Department of Health guidelines as well. And then the third group would be any person of any gender who has had exchanged money or goods for sex. And then finally, I just want to say anybody who thinks they're at risk in any way should consider getting the monkeypox vaccine. We're not going to make you prove that you meet any of these criteria. So if you come in and say that you're at risk for monkeypox, you'll be able to get the vaccination.
Okay, and Ochsner is offering vaccinations right now, so if you fit into those categories, you can visit ochsner.org/monkeypox for more information. You can schedule through myochsner.org or the new My Ochsner app. If you want to call, you can also reach us at 844-888-2772. So definitely, if you reach those criterias, feel free to schedule with us. Dr. Kemmerly, I was wondering if you could explain how many doses of the vaccine you would get with the monkeypox vaccine.
It's 2 doses, a series of 2 doses, 28 days apart.
Okay.
And like any vaccine, we know that a little bit of dosing, maybe not the whole vaccine, you're most protected 2 weeks after the second dose, but we know that if someone comes into contact with monkeypox and they've had 1 dose, that's better than none. And certainly the second dose is better than just 1. And then the 2 weeks after the second dose is where you're, ultimately protected, but some is good. So I think that's important to keep in mind.
Okay, great. And that kind of brings up a good point. I know I've seen reports of the U.S. Authorizing a plan to stretch the nation's limited supply of the monkeypox vaccine by giving people a lower dose called dose sparing. So Dr. Baumgarten, I was wondering if you could just explain if this is still effective. Should anyone be concerned that they are receiving a little bit less of the vaccine than they normally would?
So the vaccine is being given a little bit differently, and the reason we give it a little bit differently is to actually encourage that response. So we know when it was originally given, it was given what we call subcutaneously or underneath the skin. But there are some studies that look at people's titers or responses to the vaccine, and it looks like when we give it intradermally, which means right into the skin, kind of like we give a PPD or a TB skin test, if anybody has had one of those before, it's very similar to that, or it's actually exactly the same as that. It kind of induces a good immune response that way, and so that's been borne out in some of the data that they've looked at in terms of titers. And so we wholeheartedly expect that people will get just the same immune response from getting it intradermally as they would getting it subcutaneously.
Okay, great. Dr. Kemmerly, if you do get vaccinated and then you test for monkeypox afterwards and you do come back positive, what should you do in that case? Should you still get your second dose, maybe if you're in between doses?
Absolutely, you should finish the series. And we do know that people that develop monkeypox either can get the vaccine, they don't have to wait through, they're completely well. The problem is, in some cases, the health department has arranged for those individuals to be vaccinated. The problem is that the isolation period is pretty long for people with active disease. You have to wait, till all the lesions are completely crusted over and new skin forms. So that may take a few weeks. So, from a healthcare perspective, we don't want active monkeypox coming in for vaccination. But there's no reason if you have active monkeypox that you couldn't get vaccinated. You just have to work out the logistics.
Okay, great. And with vaccines, especially that we've heard over COVID, I think sometimes people's main concern is what kind of side effects that they might get from the vaccine. So I was wondering if you could touch on that as well.
Sure. With any vaccinations that we give people, whatever COVID, tetanus shots, flu shots, you name it, people can develop fever, headache, redness, soreness at the site. Some people may be fatigued, run a little bit of temperature, but it generally goes away in a day.
Okay,
and
great.
So it's a vaccine, and the vaccine side effects are there.
Yeah. And Dr. Denton, if someone does come into the office with monkeypox, I was wondering if you could walk us through kind of what the treatment options would be to help treat them for any sort of pain that they might have with the sores or anything they might be experiencing symptom-wise.
Yeah, sure. Let me back up one second with the vaccine eligibility as well. I know a lot of folks are worried about Southern Decadence coming up this weekend. Big festival, a lot of at-risk folks, big crowds might be gathering. It would be important to get the vaccine now, even though we're less than a week out. It's better to get the vaccine now so that you're prepared going into Southern Decadence. If you do go through Southern Decadence and have been exposed at that point, you can get a vaccination within 4 days of that exposure to prevent you from possibly getting monkeypox. So I would recommend, if you're worried, going to get the vaccination this week before Southern Decadence. And then if you do have exposure and haven't had the first vaccine, going to get the first vaccine right afterwards.
Okay, great.
As far as treatments for monkeypox, there are no specific treatments for monkeypox, and there are some treatments out there for smallpox that we might be able to use, but those are reserved for people who are really sick, who get admitted to the hospital, and we just really aren't seeing that level of disease, people getting admitted to the hospital. Most of this is symptom-based management, so pain relief, topical pain relievers for the lesions. Some people use some agents for neuropathic type pains that can help with the lesions, and then things like Tylenol to control the fever and some of the other muscle aches and stuff like you would with any flu-like illness.
Okay, great. And then, another thing that I have seen just on the internet, of course, is people occasionally getting sores in their mouth and them talking about how that is pretty painful. So I was just also wondering if you could touch on any sort of specific treatment options that someone might follow to treat that pain.
Yeah, again, it's a tough situation. We don't have any specific treatments for monkeypox itself, so we're treating the pain. So it would be a topical analgesic that somebody might swish around their mouth and spit out to help reduce the pain. Again, though, as we've said, mouth lesions are not that common. Mouth and eye lesions are not that common. It's more commonly in the the general area or the rest of the body.
Okay. And I think another concern, when people do develop these lesions is just maybe concern that they could leave scarring or any sort of like blisters after, the blisters start to heal. Are there any ways to prevent scarring from occurring, Dr. Baumgarten?
So it's just important to take care of the lesions as best as you can, and to prevent scarring, of course, not pick at the lesions. That's really key too. So you just want to cleanse them with a gentle cleanser, not pick at them, and then as they heal, the scarring will improve over time. Sometimes scarring can leave that dark kind of area where you have had inflammation. We call that in medicine post-inflammatory effect. And so when that occurs, this pigment in the skin is darker than the surrounding skin. And so some dermatologists talk about wearing sunscreen to try to eliminate you from getting any more darkening of that pigment in that area. So if it's in a sun-exposed area, you can also try to do that to help prevent that from occurring or from worsening. But it's just a matter of time.
Okay, great. Well, that does look like all the questions we have for today. If there's anything we didn't cover today that you want to, let the people watching know, feel free.
The governor announced right before we went live that the state is actually getting 6,000 additional doses in preparation for Southern Decadence. And so where appointments have been limited tremendously over the past few weeks, everywhere, it looks like it will quickly open up. Certainly we will get more doses in the state and the health department. So I think this is great news. I think kudos to our state officials for lobbying in the White House to get us some more doses in preparation. So as I mentioned, even though we're a week out, it certainly would be better than not being vaccinated at all if someone's exposed.
Certainly. And just as a reminder, vaccines are available right now. So if you are eligible and you want to schedule, you can do that through myochsner.org. You can do it on the new My Ochsner app, or if you prefer to call, you can reach us at 844-888-2772. Thank you all for being here today. I think we learned a lot of valuable information. If you want answers to any additional questions, please visit us at ochsner.org/monkeypox, and have a great rest of your day.